to our channel. My name is Ray, and I work here at the San Francisco Center for Compassion-Focused Therapies. So we're really lucky today to have both Chia-Ying and Amanda joining us. Chia-Ying is a licensed clinical psychologist, and Amanda is a professional organizer. So I will pass it over to Chia-Ying to introduce herself to you.
Thank you, Ray. And I'm very glad to be having this conversation with Amanda and you. And I am the director here as SF Compassion. And I work with people who experience hoarding issues. And I also work with clinicians to provide trainings and supervision about this topic. And of course, we also use a lot of compassion-focused therapy in our practice. So that's also one of our specialties. And we're very glad to have this conversation with Amanda, who is a very, very well-respected professional organizer who works with people with hoarding issues. Amanda, would you like to talk a little bit about and introduce yourself?
Thank you. I'm glad to be here. Yes, so my name is Amanda Scudder, and I'm in the Richmond, Virginia area, and my company is called Sprucely Home and Lifestyle Solutions. And I have been in the organizing profession for about 9 years and have received specialized training in working with people with hoarding disorder, people with ADHD, and other brain-based conditions that can really make it difficult to get and stay organized.
Awesome. Thank you both so much. And so kind of as we get started with our chat today, I wondered if you could share a little bit kind of about your work and what it means to support folks with hoarding experiences.
Would you like to go ahead first, Amanda?
Sure. Okay. So in my work, I like to say I do a real big range of people's life experiences, and there's a lot of different ways that an organizer can help with those. But specifically when I'm working with somebody who does have hoarding disorder or has been diagnosed with hoarding disorder, for me it's really important to make sure that that person is also connected with somebody in the mental health field who's providing therapeutic support, because that makes the process work for everybody. And basically, I think the most important things that the people in my profession that do work with challenging disorganization can bring to the table are empathy and compassion, understanding, patience, creativity, and just a lot of creative problem solving. So what I've enjoyed most about the work that I do is just the opportunity to really get to know somebody, figure out what makes them tick and what they like and what they're trying to accomplish, and then kind of match up my toolbox with what they're looking for.
Awesome. And Chia-Ying, would you like to share?
Yeah, like Amanda said, that when I think there's some common ground here, which is about curiosity and compassion, and I think that like these two professions work so well together. And speaking from a therapist perspective, what we do in a room with our clients in therapy is that we help them to also like understand what's been the challenges for them, and not so much focusing on the physical stuff, but more about the psychological stuff, because for hoarding, it's like there's like multifaceted. But the most obvious is this invisible heart, something inside a person, and this very visible part, that is the object and the so-called clutter, or a lot of objects at home. And so while our clients is like wanting to address the visible things, there's also this invisible thing that's getting in the way. So what a therapist does is to help them and understand, see the invisible part that is causing the suffering, or that is suffering. And so how do we have compassion to help that invisible part, so that we can make the external or the visible part work more smoothly. Yeah, and so I'm just very excited to have this conversation with Amanda about how how we can work together to address these two different parts very closely related to hoarding.
Mm-hmm. Absolutely. And I think this is a perfect kind of segue into our next question, which is how can therapists and professional organizers collaborate together in this work? And Amanda, would you like to start?
Sure. I've been very fortunate to work with several therapists who are familiar with what organizers do and it's been a very collaborative exchange and relationship, and that's really been a great experience. I think where I think it helps most is when there's open communication, everybody sort of becomes part of the team. And so the therapist is a team member, the client is a team member, the organizer is a team member. And as an organizer who knows my community, I'm also able to bring in other skilled professionals who are compassionate and who do understand that a situation may be more complicated, and add them to the team. And so it's really about putting the right pieces together. And then when you have that team together and you do have the open communication, areas that I've seen to be really beneficial are clarifying goals and then making those goals actionable. And so a goal may be set in the therapeutic environment, but a client can really kind of spin wheels sometimes when they get into the home environment and try to figure out how do I make that happen. And so knowing what those goals are, I'm able to help them kind of stay focused and figure out the first step to take and kind of break things down and make it doable. Another area that I found has been really useful in the therapeutic relationship is to be able to help be a neutral observer about what's going on in the home setting and be able to reflect that back both to the client and to the therapist. So if I see where there's an area of somebody getting stuck, I can bring that to the client's attention and can encourage them to bring that back to a therapist for a deeper conversation. Or if I see that, somebody's been prescribed medications, but the home is so chaotic that those medications are kind of getting lost or not being taken as prescribed, I can offer that feedback and also help set up some systems that make consistency a little bit easier and kind of troubleshoot those really practical things about treatment. And then there's just so many opportunities for just being mutually encouraging and supportive, which I think is really helpful. A lot of times we do work in isolation, and so knowing that you've got other people with different perspectives who can kind of help you troubleshoot and problem solve is really great too.
Well, that's very informative. Thank you, Amanda. And I have so many questions for you, but and I can imagine this. It's kind of like in the therapist world, we also sometimes, for instance, I work as somebody's individual therapist, and they also have a couples therapist, for example. And sometimes the two therapists, or even the third therapist, like their partner's therapist, we will collaborate and we will talk on the phone with the client's permission to figure out what do we see, how what the situation is, to exchange perspectives and to help the clients together as a team. And so that's kind of like very like how I can imagine how that kind of teamwork can happen. And in my own experience, I also have collaborated with a handful of professional organizers, and it seems that what I have come across is not a very ideal kind of setup. That's kind of like where the challenge comes from. It's that there is a lack of time to for everybody to sit together, because when I'm listening to you, my imagination is that maybe even from the get-go, the client is on board with seeing multiple people, and then they all have a group meeting perhaps in the beginning, and then later on they work separately but stay communicative and keep each other updated. But that sounds like an ideal scenario that probably is not everybody has the resources to be able to make it work. So I'm very curious, how do you see any other kind of variations to that, and how do people creatively make this still work, the collaboration still work?
Yeah, and I agree. It's very rare. I have had an opportunity to sit on a couple of treatment teams, and that's ideal because you've got everybody at the table and you're all talking at the same time. I find a lot of times what I end up doing in my role is being sort of the communication hub, and then I can connect with the different people. And resources are challenging, and one of the barriers I was gonna bring up later is that really a lot of professional organizing services aren't reimbursable through insurance, and so somebody really has to have the means in many cases to be able to bring somebody like my profession in. But when they can, and when we can be part of that treatment team, that is the ideal. When that's not happening, it's generally I sort of put the client in that communication hub role and ask that client, if it's okay. We always get written consent to communicate with a therapist or anybody else, a family member, whomever. But assuming you have the consent to communicate, it can be helpful to have just a brief conversation. I've even had therapists come to the home while I'm there doing the work. And it's the first time often that they've laid eyes on the situation, but it's just a great opportunity to show like we're here together, we're supporting you together. And it doesn't take a lot of time because really you kind of already know the goals, and I don't need to know in depth what someone is working on in therapy. I just need to know how can I help them get and stay unstuck and keep moving forward. And so I think, it can be as simple as an email. I've had one situation where at the end of each session, I would email the other parties and say, this is what we did, and this is where we are, and here are some of the barriers I'm seeing. And then the other people on the team can take it from there and do what they need to do with that.
Mm-hmm. Yeah, that's a very good good perspective and good experiences that you are sharing. And I'm imagining, say if a therapist and a professional organizer, they have experiences working with each other, they would kind of know each other's styles, and they would have the communication would become easier and easier as time go by. Yeah, I do see so much benefit potentially coming from the two professions working together, because I see that some people entering, like, this is such a tricky thing to be asking for therapy for. So there's a lot of reasons. As Ray and I both interviewed some peers in the same series in this YouTube video, we discovered that there's a lot of shame around this area, and there's also a lot of fear about getting help, like getting judged, or they'll be made to throw things away. So getting help is a tricky thing, and some people find it a bit more easy to get help from like dealing with the stuff, and other people find it more easy relatively to get help from dealing with the mental health challenge. Yeah, but there is like each profession has its specialty and has the limitation. For instance, if you ask me, okay, I can do like simple like problem solving about, okay, you have 10 boxes, let's isolate your goal. Instead of thinking about 10 boxes, let's think about one box. Instead of thinking about that one box, how about let's think about opening that box. So with that, there's psychological strategies I can help clients to simplify their goals and to make it less overwhelming. But to be very, very honest, that I have seen and talked to professional organizers, their skills is just something that I really don't have. Like, how do you make the quantity become like make sense? Mm-hmm. I can organize my home, but if you give me much more than what I have in my home, I'd feel like, oh my God, I need some help too. Yeah. So it's really wonderful that if the two professions can work together and have the communication open. Yeah.
Agreed. And you made me think of something that I wanted to at least mention, is that because of the specific therapies that you're in, you are very aware of the physical environment and how clutter is affecting someone. But I have come across therapists that tell me, well, I don't work with anybody that has hoarding disorder, or I don't work with people that have challenging disorganization. And then I've later found out that we had a mutual client because they just never asked what was going on in the home. And so I think that awareness, having therapists aware that the home environment is affecting the mental health and emotional health of someone is really important. And I'm so grateful to know therapists like you that get that and understand it. But there are some tools out there that are pretty straightforward to use that can assess the subjective and objective levels of clutter in a home that I think if we could get word out about that, that would be helpful too.
Yes, we definitely should get the word out there. So it's such a big issue that you're pointing out, that even in the mental health field, a lot of therapists would think, oh, that hoarding is a pretty rare situation, but it's not. It's so prevalent. Yeah, it's between 2 and 5%, and that's probably even an underestimation. Yeah, and so especially if you work with people with trauma history or depression,
Mm-hmm.
these are very relevant.
I even read a study recently that ADHD symptoms are very highly correlated. There's a much higher percentage of people with hoarding disorder among people with ADHD.
Right.
So there's so many. Human mind is a very complicated thing, and there's so many interconnections.
It is.
Mm-hmm. Thank you both so much for really expanding upon these questions and kind of engaging with this. And kind of as I'm listening to the both of you, the kind of question that kind of came to my mind was, what would you like folks with hoarding experiences to know about how to get support with their physical and mental health?
I would say, please know that there are many people out there that are professional organizers who have extreme compassion for what's happening and don't have a judging bone in their body. And so I can't tell you how many people have finally let me in the door, and they've been so fearful of what I'm going to say or do. And once I can actually kind of establish that trust and people realize that I'm not there to judge, I'm there to be supportive. I'm not there to make people get rid of things. I'm there to help them achieve their goals and make their own decisions. It's just like a huge weight comes off their shoulders, and I wish more people knew that that's what the experience can be like. And I would encourage anyone who is looking for help to go to the Institute for Challenging Disorganization. There's a website, and you can find people that are certified, that have gone above and beyond in certifications to become specially trained to be as helpful as possible. So that's what I would want people to know.
Thank you, Amanda. I think that, speaking as a therapist, what I'd like to clarify is that psychotherapy for hoarding is not about the stuff. Yes, it is about like reducing the stuff, but it is about you, about your well-being, about what's inside of your heart. And I can totally honestly say to anybody, if you come to me and you really tell me, actually having all the stuff makes me truly happy and truly feeling fulfilled in my life, then there's nothing we need to do about your stuff. Yeah, it's all about your well-being. And so it's not about getting rid of your stuff. It's also not about judging you for how much stuff that you have. It's more about getting curious to understand what's going on. What does stuff mean to you? Are they making you happy? Are they making you feeling more fulfilled in your life? And that's the most important thing. And if the answer is, well, I'm not sure, then let's dig deeper and let's explore more. And if then you realize, oh, perhaps not, then we can learn, okay, then what's going on? Why are you holding on to them? And then look into the fear or the attachment. And then that would tell us more about you as a person, because the most important thing that matters is you and your well-being, because that matters to everybody around you, not just you. Yeah. And I understand it's very hard to open our heart, to open our hands, and there's always a risk of our feelings getting hurt. We get disappointed, and even when we are looking for therapists, a lot of times we may have to try a couple of people to find the right match. It doesn't mean that the people who are not the right match, they mean to hurt you, but it's just not a right match. And I think it will probably be the same with professional organizers. So you can test the water and you know what you can tolerate. You can say, how about let's meet outside of my door and let's have a conversation first. And then I'll think about it. And then next time I can let you know if I would like you to come into my home. Yeah, so take baby steps. You don't have to open your door right away, but do take the baby steps.
Mm-hmm.
Great. And I just want to add, because of the pandemic, I know a lot of professional organizers did add virtual components to their work, which can be a nice way to test the waters without actually having to let someone in. And it gives you a lot of control over what you want to show someone. And I found that that was a really helpful tool for some folks that had been on the fence about whether or not they were comfortable kind of testing the waters. So, explore whether a virtual consultation might be an option, just to give you a sense of how the person is and what you think.
Mm-hmm. It sounds like really what I'm hearing from both of you, although you're coming from different fields, this really kind of shared compassion and this shared support and care for the folks you work with, as well as really this message of the power is in the client's hands, that they define the process and their goals. And I think that's really such a beautiful thing. And so kind of segueing into the question of what can both professionals and our clients gain from this team-oriented approach. Would you like to start, Amanda?
Sure. So I think there's just so many benefits, both for the individual and for the team, because there's just strength in numbers. And when you bring people together to think creatively together, it's a synergistic thing. So I think that the synergy is, for me, the biggest part. But it's also that ability to leverage each other's strengths. And as an organizer, we always tell our clients we're not therapists. There's a lot of stuff that's attached to stuff, and we deal with a lot of those feelings that come up. But there's a very unique and special role for therapists that can be extremely helpful in helping someone achieve their goals. So it's just like it magnifies the effect of what everybody's doing. I think a client gets a better result. I think the progress can be more consistent and can progress at the most optimal rate. And I think that just for the professionals that happen to be part of the team, there is something great about having the support of somebody else and to be able to troubleshoot, like I mentioned earlier, with someone who is equally invested in making things as wonderful as possible. So I've benefited a lot in my profession being able to collaborate with some great therapists, and I've seen my clients benefit too.
Yeah, very, very similar to what Amanda just shared. I think that it's like there's different perspectives. It's like we're putting a puzzle together. So we need different shapes to make it more close to be whole. And so of course the client is one of the key puzzle piece, and we provide different things to help. Yeah, and I do see that practically in my work with clients in therapy. I can very often see that they are on the verge of getting ready to put their hands on things, but it would be so great if there's somebody there to hold their hands, to be there with them physically or virtually between the therapy sessions. That would give them kind of like some kind of company or empowerment, or someone is here with you when you're doing this. Yeah, and that step, that kind of like is a bridge to make the progress go like a little bit more smoothly. Because a lot of times we may have the intention to do it, but without the person, somebody that we can trust being there, it's just making it even harder. Yeah, so that is something that I think is a great resource that clients can consider to have.
Mm-hmm. And I know Amanda mentioned a great resource for folks looking for support, especially around professional organizers, the Institute for Challenging Disorganization. And I wanted to ask you both if you had any resources for who are interested kind of either in this work and kind of in this collaborative space. How do we do it?
There will be some trainings that I will be giving to clinicians who are interested in learning about treatment for hoarding, especially applying compassion-focused therapy. And so I do trainings throughout the year multiple times through different agencies, and we have our practice has a social media channel. The name is Better Treatment for Hoarding, and you can follow us on Instagram or Facebook. And on there, we have a lot of resources and updates about what we provide for clients and what we provide for clinicians. And so that would be a great resource to follow. And besides that, I think generally just I think there's a lot of good stuff on the internet. And the IOCDF Foundation, of course, is a big hub. They have a lot of resources, not just about OCD, but also specifically about hoarding. That's kind of like my entering point to learn about hoarding. So I would really highly recommend that to therapists or students in the field that wants to start to learn more about hoarding.
I had to stop and look up the name of the book, but there is a book that was put out by the Institute for Challenging Disorganization called The ICD Guide to Collaborating with Professional Organizers for Related Professionals. And that's a good resource for anyone who's looking at how can I bring a professional organizer in and make it a constructive therapeutic partnership. And then I agree with all of the other resources that you recommended, and I think I think it might be through IOCD that has the clutter image rating scale, which is a resource that is an objective level of clutter visual scale. And then there's on the ICD website, the Institute for Challenging Disorganization website, there is the Clutter Quality of Life Survey. And it's an online tool that someone can use as a self-assessment or a professional can use with someone who wants to explore whether or not clutter might be affecting quality of life in a number of different domains. And it's just a great conversation starter for either yourself to bring to a therapeutic relationship or for a therapist to invite that conversation about the physical environment.
Thank you so much for circling back to this screening questions. It's very important. In almost all of my training workshop or talks, I always say, clinicians, if you have any decision power to add 3 questions in your intake process, add 3 questions. Just simply ask, do you have more stuff than what your space has to contain? Such questions like that. And so it kind of like, well, for people who don't have this issue, they may think, oh, well, how is this relevant? But for people who has this issue, this is a hint that I am curious about this, about you, and I can help you. Mm-hmm. That kind of opens the door for that conversation to start. Yeah. And maybe we can put the clutter image rating scale, the link in the comment in this video. And then there's also some there's a 5 question, just standardized questionnaire that we can also put the link there. So these are all very easy to simply include in your intake process that you regularly do.
Yeah, very true. And another just quick, easy question is, are you able to use rooms the way you'd like to, or the way they're intended to be used? And that can really open up a conversation.
Right. Yes.
Yeah, we'll be sure to include both kind of client resources and also clinician and allied professional resources in the description. And so kind of as we're wrapping up our conversation today, I just wanted to open it up to both of you to share anything that felt important that you would like folks to know, any reflecting final thoughts.
I wanted to say it's been such a pleasure getting to work with both of you and learning about your important work with compassion-focused therapy and helping us as organizers think about how we can bring those techniques and tools to our own practices with ourselves and with our clients. And so it's just been really wonderful to have this conversation with you all and be able to kind of come full circle to how do we keep working together.
Thank you so much, Amanda. You also have been teaching us so much about professional organizing, and we really grow so much respect for the opportunities to be able to collaborate with this profession. Yeah, and one thing that I'd like to remind and just to emphasize again for people who are out there listening to us, and first messages for people who experience hoarding. See how you can take very, very small steps to open yourself. Even it's just like this bit or this bit. Just take very small steps, but consistently take that baby step to open yourself. Either to yourself, open it to yourself, open it to somebody you can trust, open it to reach out for help. Yeah. And for people who are family members of people who suffer with hoarding experiences who are listening in today, I will also encourage you to grow the curiosity, to wonder what's behind the stuff. Yeah, and to not see if you can calm the part of you that wants to problem solve, that wants to jump in and then clear everything away, because that will not work if the person is not ready and is not in good hands with consistent and like good care. Yeah, so I'm very glad to have this conversation with you, Amanda, and thank you so much for being such a great host, Ray.
Thank you both so much. Did you want to share anything, Amanda? Oh,
yeah, I think I already did.
Okay. Well, thank you all for joining us. We're going to be continuing kind of this series around really inviting diverse perspectives, both with people who have lived experience with hoarding, with other allied professions, and really just trying to invite this supportive space to raise awareness and to learn from each other. So thank you so much for joining, and we'll see you on the next video.